to work with me at my PRN job as an LPN in memory care.
So today I'm working my other job that I work PRN. I work in a memory care facility, PRN. My other job, I work in the hospital on the Medsurg floor. And just gonna show you guys how I start my day in a memory care facility. So over here is the orange juice that I use when some of my patients don't want to take their medication. I just crush it up in orange juice in the mornings. And then that's the pill crusher. I keep it over here because I like to be organized and I don't need nothing in my space. And over here is my cart, and this is where all the medications and stuff are. And this is the computer that I, of course, will have the MAR pulled up, and I do my patients one by one. Check their vitals, of course, see if it's appropriate to give blood pressure medicines, heart medicines, you know, nurse judgments, type of stuff. So the only thing that I really don't like about working in a memory care facility or a nursing home is having to count this cart at the end of shift with the nurse, versus in the hospital all I do is give report and I can go. But here, of course, you give report if anything is going on with your patient, and you got to count this narcotic cart, which, yeah. Good thing about working in a memory care or nursing home is that the medications are already in the package. So all you got to do is just match it up with the MAR. Make sure that the medications that's on the MAR is in the patient's pack. And then you just rip them bad boys out and put it in the cup. Versus in the hospital, you know, you have the Omni cell where you have to pull out all of the medications one by one, which can kind of be annoying if you have a patient that's getting like 17 meds. So yeah, it's a little bit more work as far as getting medications versus in a nursing home or memory care, but I like both my jobs, so it is what it is. So the one thing I love about working in memory care is that if I'm having a bad day, these patients literally will have you cracking up at the things they do, the things they say. And it just brings me joy to work in a memory care facility. It's getting some blood pressure meds, and she's getting Lasix. I always check the blood pressure before I give any blood pressure meds, any heart medications, even Lasix, because if the blood pressure is low, you don't want to give Lasix because Lasix can cause the blood pressure to go even lower. So, okay, another pro about working in a memory care facility versus a hospital is that you have more time to pass your meds because you have more patients. Like I have 19 patients, and when I work Medsurg on the hospital floor, I only have 5 patients. So working in this facility, you have between 7 a.m. and 10 a.m. to pass your meds. So what I do when they are sitting in the dining room eating their breakfast, I go ahead and pass them their meds to go ahead and get it out the way. All right, so this patient gets a Mighty Shake with every meal, and she is in the late stages of dementia, like severe. She has severe dementia. So I crush her meds up because she really liked these. I crush them up and put it in this, and she drinks it. She gets 2 gummies, 2 of these lemon juice. And she likes sweets, so she'll definitely take the gummies in her calcium. She's also getting some potassium. It's a new shot. These 2 pills here. And then we're gonna go over here and we're gonna crush them. These little things, the medicine here. Crushed very fine. Okay, then we're gonna take our cup. And what I I do is to make sure that I get all of the medicine. This is what I do. Pour a little of this in there, and then just make sure she gets all of her medicine. This is a trick that I learned when I first became a nurse from an LPN supervisor. I'll put a potassium in there, let it shake. I'll give it a good stir. And voila, the magical drink. So it is now 8:33 and I am done with my morning med pass. I started at about 7:05, so I'm gonna sit down and put my vitals in. You finish? Finish with your water? Okay. I'll throw it away for you, don't worry. Sit down, Shirley, before you fall. Come on. Come on. Come on, let's go sit back down, okay? Come on. This way. Shirley, why are you over here talking about people? Huh? Why are you over here talking about people? Okay, so it's now 10:17 and I'm about to have breakfast. I'm gonna eat this sausage, egg, and cheese muffin. Yes, I got it from the gas station, but sometimes that gas station food be smacking, so we're gonna see. And that's how it looks. Let's see how it tastes. So beautiful out here. It's like 76 degrees. I'm in Tennessee, but originally from Ohio, so I know it's probably kind of chilly down there, but I'm about to enjoy these little Reese pieces and have a little break.